Mary Neubauer is the third winner in this category. Mary is a tireless advocate and respected leader in the mental health community. She currently serves as a certified peer specialist at Community Advocates Autumn West facility. West is a dual assistance program for people who are homeless and living with mental illness. She's also a co-chair of the Milwaukee Mental Health Task Force and has been instrumental in advancing policy changes on the local, state, and national level. That's not easy, you guys. Her job, she says, is to help provide a sense of normalcy and to be a living example of recovery. Please warmly welcome Mary Neubauer.
First, I'd like to thank the BizTimes for providing me the opportunity to be here and acknowledge my role in the community. In mid-November, I received the phone call that I was chosen as one of the 2015 Healthcare Heroes, the behavioral health category for my work as a certified peer specialist. I hope you're wondering what a certified peer specialist is. Actually, if I were to perform a statistical calculation of you saying yes with a p-value of 0.05 and confidence level of 95% and plotted it on a bell curve, I had no clue what it would fall. My friends, family, and colleagues may be wondering what I'm talking about. I hope it's them that is wondering what I'm talking about. The example of this calculation is what I learned from a textbook while in graduate school to become a social worker. The only requirement was to have taken an undergrad statistics class. There were no textbooks in graduate school to teach my fellow colleagues about the recovery from mental illness. The basic requirements to be a peer specialist is to have a mental illness in recovery, and that is what I do. I was able to enter my recovery well over 30 years ago and have had the support of many people. Recovery is a difficult journey for me. It's a process and not an event. It's like a spiral staircase where I go a few steps up and a few steps back and a lot of steps up, and then I've learned to pause and take some time to look at what's going around. And right now I'm in a pause. I've been kind of out of the arena for a couple months now, doing some very important work that I need for my own self-care. And it's through that self-care of myself that I can do the work as a certified peer specialist. Jean Lowry was the visionary of Autumn West back in about 1999, and it was born out of her vision, a vision to provide a shelter for individuals with mental illness that were not being served. I met Jeannie back in 2006, right after completing my actual training as a certified peer specialist. Jeannie planted the seed for me to start a peer specialist program at Autumn West. What I failed to mention was when I took my peer specialist training and met Jeannie, I also was homeless. I had the opportunity of my lifetime. I had a vision of what a program would look like, and failed to mention that Jeannie was there to support me all the way along with the other staff. I'd like to share with you a little thing, Marie's story. I'm impacted by the lives of many people now that I've been doing peer specialist for 9 years and the other work I do in the community. About a year and a half ago, we have the Homeless Outreach and Nursing Center that's also located in this, co-located with Autumn West. And I was touched by the story of one of the nurses who said, there's somebody that's come in that said they know you, but they're really fragile right now. And I was explained what the situation was, and it actually had been somebody that had recently been raped and had some very significant issues, and had been homeless, was a professional. Because of the incident, they lost their job because they weren't able to go to work and pay their bills, and were living in a garden before they came to Autumn West. When she told me the person knew me, I didn't know where. Out in the community, I do a lot of things. I'm on the Milwaukee County Mental Health Board, and I'm part of a production called Pieces in My Own Voice with the National Alliance on Mental Illness here in Milwaukee, and we do a theatrical performance and often at universities. So I thought this is where I knew the person from. Well, I eventually got to go up. We have a 4-story building, and I went up to the floor that the person's room was on, and I knocked on the door, and I stepped back about a foot because I had a piece of paperwork. And she opened the door, she just kind of peeked out, and I was very respectful and stepped back, and she came out, and I handed her the piece of paper. Well, our relationship developed, and things started to grow. I eventually had the opportunity to ask her where she met me. And what she said to me was, before I go anywhere, I do an investigation of where I'm going, and this is somebody that's significantly younger than myself, And she said, "I knew you were safe." And I kind of paused, and I said, "Well, how did you know I was safe?" She said, "I saw you on the morning blend with Walter, your boss, and you talked about community advocates, and I knew it was a place that I can go. That's why I do the work that I do." Community Advocates has offered a constellation of programs to serve people in our community with the greatest needs. The program I work for at Autumn West Safe Haven, providing transitional housing for our most vulnerable citizens, homeless individuals living outside due to their severe untreated mental illness. I work side by side with the brightest stars in the constellation for the team from Autumn West. If I'd like to acknowledge you guys back there. Matt Raymond, the director the manager of the Autumn West Safe Haven. Our chief executive officer isn't here because Manuela is covering the phones. And I am also, I am truly blessed and guided by the leadership of Andy Elliott, our chief executive officer. With Andy and Matt, I have their full support doing the things that I need to do out in the community and the flexibility, and they support me in every step of the way, and I couldn't ask any more from that for my Community Advocates family. Thank you. I'd also like to thank my family and friends that are here today. It's my family of choice and many friends, of which I've wholly been supported over my recovery. My passion is what drives me to be an advocate for change in the way, what, and how when quality services are provided to people with mental health and substance abuse issues. When services are not provided, it is my compassion that keeps my eyes open to see a person for who they are and not a label attached along the way. Keeping my ears tuned in to hear the unique story of each individual and the message they carry. Congratulations to each of the 2015 Healthcare Heroes. Thank you.